Good morning, everyone, and a very warm welcome yet again to Health Insights Live. For those joining us for the first time, we've created this series to discuss healthcare challenges that are facing businesses across the UK, all part of our commitment at Bupa to keep you informed on the latest trends that we're seeing across the wider healthcare market. What we're trying to do here is to help you and your clients navigate the health and wellbeing landscape and to make sure that ideally you always feel one step ahead when it comes to the healthcare issues facing your workforce or your client's workforce. As well as these events, with this week, we're delighted to have launched the Bupa Academy for Health and Wellbeing. These are workshop-style events that will help you get closer to certain healthcare topics, maybe go much deeper than we go in Health Insights Live, all designed to achieve that fantastic aim of improving workplace health. So if you've seen that, you'd like to attend, you'd like to know more, please reach out to your account manager. For today's main topic, we're going to be addressing health and wellbeing in the future workplace. Now, the pandemic has changed the health and wellbeing needs of many employees. And once restrictions lift in the UK, people will face even more change as organisations transition to hybrid working or a return to the office. On one hand, this will be transformational for the world of work, as flexible working has many benefits for people's health. On the other hand, it will be a complex transition for businesses who need to balance the needs of customers, people, and performance. And words like hybrid really, in terms of the business, weren't in our language even 2 years ago, and now it's on the tip of everyone's tongues. At Bupa, I've been involved in shaping our new way of working, which is going to take, unsurprisingly, a hybrid approach. And it's very clear after listening to our people that there's not one set answer for that. What's right for one person, one role, one team isn't right for another. There's no one-size-fits-all solution here. Our challenge at Bupa is how we provide flexibility and choice so people have two places of work, home and the office, both seen as the same, with one not being a reward over the other. But wherever we are, we need to ensure our people's well-being is supported and that we continue to deliver for our customers. As organisations across the UK plan for life after the pandemic, it's vital they consider the physical and mental health issues that new ways of working present, requiring businesses to adapt more than ever to those individual needs of their people. Today, we'll discuss some of the key health issues we expect to see in the workplace as we emerge from COVID, including the rise of musculoskeletal MSK conditions. Why MSK? I asked my team that question. Why have you picked MSK? That seems like a strange topic given we've talked about cancer and mental health. It didn't seem that significant to me initially. But research from Bupa states that last year, 11 million adults in the UK injured themselves as a result of their home working environment. And worryingly, only 1 in 10 sought medical help, potentially causing long-term damage for many employees' physical and mental health. Today, we'll be asking our experts what organisations can do to identify, adapt, and support facing into this challenge. So in terms of today's agenda, we'll use the first 15 minutes to hear from Dr. Luke James, Group Medical Director, on the status of the pandemic and our predictions for potential longer-term health consequences. We'll then host a panel discussion on the rise of MSK conditions, where I'm delighted today to be joined by our panel of experts. Firstly, Emily Partridge, MSK Clinical Lead for Bupa Health Clinics. Emily is a physiotherapist and has been at Bupa for 11 years. She leads a team of 100 MSK clinicians and will be sharing her team's experiences on how the MSK landscape has changed from a clinical perspective as a result of COVID-19. We're joined by legal advisors Osborne Clarke LLP. We have both Mary Lawrence, partner, and Breege Murphy, legal director. Mary heads up Osborne Clarke's health and safety team and is currently spending a lot of time supporting clients in their thinking around health and safety risks in the new world of work. And Breege is Osborne Clarke's personal injury specialist, so can provide some really helpful insights on claims. And finally, we're joined by Cherry White, Workplace Wellbeing Manager from charity Versus Arthritis, who's going to talk to us about her latest insights and advice on how best to approach MSK health in the workplace. And as always, once we've done the initial panel discussion, we will open it up to your questions. So please take the opportunity to use the chat and get those questions in, and we'll answer as many of them as we can. So without further ado, let's get started. Over to you, Luke.
Thanks, Mark. Good morning, everyone. Great to be here with you again today. I'm going to spend about 15 minutes updating you on the status of COVID-19 across the UK, a bit around the private hospital capacity updates, and I'll also focus on 3 potential longer-term health consequences that we expect to impact employees as we head back into the workplace. So where are we at the moment? Well, it's pretty grim data on the total number of positive cases in the UK. So these are cases that have been tested for is over 4.6 million. And clearly behind that sits a lot of people who didn't get a test or have been asymptomatic, maybe in their infection with COVID. So loads of people affected by this. And of course, the number of deaths now at 128,000 or more direct deaths. And we're also going to see a lot more impact of COVID on mortality from other conditions as we move into the post-COVID world. In terms of vaccinations, as of 21st of June, we've got around 82% of people over 18 having received their first dose of one of the vaccines, and pushing 60% of adults having received the second. So this is a huge success story for the UK and for the NHS and the vaccination programme. And I think we really should be aware of that. If you look at globally at the cumulative doses given in comparison to other countries, we're just behind Israel, we're ahead of the US, we're ahead of Europe and China. So a really phenomenal programme, really. In terms of whether we expect to see another peak, another wave, what's going to happen in the winter, obviously lots of modelling going on around this now. But what we have seen is that while infection rates are rising in the UK, and you've seen those figures kind of published every day in the media, and we're seeing hospital admissions slowly creep up. Primarily, those hospital admissions are among people who haven't been vaccinated. So the impact on the healthcare system of a further increase in infection levels is expected to be manageable. Now, the NHS is in a precarious state in terms of the backlog as well, and getting back to normal. Staff were exhausted. So it's really good news that the vaccinations seem to be doing what we hoped they would do. Clearly, you have heard lots around variants and the Delta variants, the last one that we're hearing about. And I think there's a Nepal variant that's now being discussed. So the Delta variant is responsible for 91% of those cases that we're seeing at the moment. And it looks from the data as if the vaccination clearly is providing a huge benefit in terms of preventing severe illness and hospitalisation. And I suppose just, one comment to make here is we shouldn't be too alarmed by the variants. They will, come down the line regularly. We will see the media concern and focus on these, but we're going to see that. That's what viruses do, and that's what will happen. We'll see more and more variants come out, and hopefully we'll see a similar situation in that the vaccines are providing protection from the more severe illness that's associated with it. So that's where we are with COVID. A quick update on private hospital capacity. We are constantly looking at this, for our members in terms of how they're accessing and being able to access hospital services. And we're very aware that the NHS is focusing on catch-up work. So some of the NHS PPUs will be focusing on that, but all of the private hospitals are now reportedly operating as normal. In terms of our pre-authorisations, they're running at above prior year levels, but we're still seeing a change in the mix of patients and potential behaviour. So we're seeing many more people start new care journeys, but we're seeing fewer people convert to treatment. We're not seeing any change in frequency of complaints about delays in care, delays in people accessing care or difficulty accessing care, and there's no change in the speed of the care journey. The indications from the hospitals that there is spare capacity, and that might be, I suppose what we might be seeing is some nervousness in patients around being admitted to hospital and proceeding with an intervention. Equally, we're also hearing that there may be a lower threshold for demanding a referral to a consultant from a GP, and that might mean we're seeing an increased level of unnecessary referrals, potentially in secondary care, which are dealt with at the first appointment and don't require further intervention. So we really need to understand more the implications for the scale and the timing of the bounce back of this activity. And the NHS is facing exactly the same problem here, in that the number of referrals that went into the NHS was millions down on a normal year. And what really isn't understood is whether those referrals are going to come back into the system. So we're doing some active research around this, and we'll share with you the outcomes of that when we can. But we're liaising with our hospitals, our consultants, and our customers to try and understand what's happening out there at the moment. So that's where we are with COVID and private hospital capacity. If we just move on now to some of the long-term health consequences, which I think is probably the most interesting part as we move on to the panel as well. So, we really have seen a tremendous response from the medical community that has really led application of new medications, development of vaccines. However, one area which I think is going to have a huge impact is the long-term consequence of the COVID-19 pandemic on health conditions that are lingering due to the COVID-19 infection. And I think as we start to maybe think about getting back to the office and getting back to normal, there's going to be longer term health challenges amongst our employees. Mental health conditions, musculoskeletal disorders, and the extended physical and mental repercussions of those infected with COVID-19. So I'm briefly going to update on a few of these, starting with long COVID. So the ONS figures from March suggested about 1.1 million people affected by long COVID. You'll see in the media today figures around 2 million being proposed from the REACT study of people affected by long COVID. And I think it's really important to acknowledge that it's going to take a long time to truly understand the longer term consequences of infection from long COVID. And there's extensive research taking place, 20 to 50 million pounds being spent on this in the UK. And, within the NHS, there's long COVID clinics running. These are physio-led. They're really focusing on respiratory problems and fatigue. And as far as I'm aware at the moment, the ones that I'm aware are running are fully booked. So there's clearly a huge demand out there for this kind of rehab. At Bupa, we're constantly reviewing the evidence around long COVID. And as I say, it's going to be a long process in terms of really extrapolating what is being caused by the COVID infection and what maybe would have occurred anyway in an individual. But the Bupa Cromwell has set up a long COVID clinic in response to GPs and consultants really telling them that they're seeing an increased number of patients that need support. And that clinic is led by a respiratory physician. So they do the initial consultation, either face-to-face or virtually. And then depending on the patient's symptoms, medical history, they can then refer on for further tests or into other specialists such as cardiac, neurology, or other specialist respiratory physicians. So in terms of what we know about long COVID, as I mentioned, estimates ranging between 1 to 2 million patients affected with long COVID symptoms. And it's really on a spectrum here. So I think it's really important to realise we've got people who have been in ITU and have severe recognised complications of that, whether that's heart complications, whether it's lung damage. And then we have the other end of the spectrum, which is less easy to define, such as fatigue or brain fog. So it's a huge number of symptoms. And I think, in fact, I think we've reached about 55 different symptoms have been attributed to COVID in the long term, lasting longer than 12 weeks. So things like fatigue, shortness of breath, muscle aches, and difficulty concentrating. So it appears to be more prevalent in females. It appears to be more prevalent in the 35 to 69-year-old age group, people living in deprived areas, and also, interestingly, health and social care workers. Now, that's really interesting. Why should that be the case? And again, research will come out to establish this in the future. But there is some speculation that health and social care workers, when they've been exposed to COVID, they've been exposed to much higher viral loads in terms of the work they're doing, and therefore may have had a greater hit from COVID infection and therefore developed the long COVID symptoms. So interestingly, at Bupa Cromwell, the average age of patients they're seeing there is 40, and with 2/3 of them being women. So clearly this is a huge problem. And for businesses, I suppose, with it affecting that many people, we need to be aware of how this is going to impact on the workplace as employees return. Now, I think there's some good news in that, hybrid working may actually be a really good option, and may help manage some of those symptoms. So if you're fatigued, you're not really going to want to be commuting 5 days a week on packed trains. So I think there's some opportunity here for employers to really recognise that if there are employees who are returning to work with some of these symptoms, then we need a really flexible, tailored approach, and the new way of working may support that. So I'll just come on to mental health, and I don't need to tell anyone here about the impact that COVID-19 and the restrictions and the social distancing and the lockdowns have had on mental health and across the nation. Now, for us, over the last 3 months, we've had more people booking mental health direct access appointments than we've ever had in a single month before. And I think that really demonstrates the volume of people that are needing support. I think it also demonstrates that we are really seeing a change in the approach to mental health, and people are willing to talk about it a lot more, so breaking down that stigma, and they're willing to access care. And of course, that's incredibly important. So some of the figures on here, our 2021 workplace wellbeing census. So we surveyed 4,000 employees across 13 of the UK's industries, asking workers how they felt about their wellbeing. And it's clear from this that employees have played a crucial role in mitigating the impact of COVID-19. So it's positive to see that 36% believe their employer is more understanding of mental health than before the pandemic. I think that's positive, but it still leaves 64% not answering in a positive way to that. But we're also seeing positive trends when people are accessing care. So almost half of those with access to wellbeing services have said that it's improved their mental health and wellbeing over the last year, and that's again, incredibly important. And 63% said they turned to their employees for more support than they had in the past. So again, we're probably seeing a bit of a step change in with this focus on healthcare in the nation that's been driven by COVID, that people are willing to look and see what's available to them and access it more. Interestingly, that the research is also showing the importance of these services for recruiting and retaining talent, which is important for all businesses. And this showed that more than 6 in 10 employees value wellbeing services offered, and 18% of 18 to 24-year-olds said that was a major reason for joining a company. So I think it is going to be important that the blend of wellbeing services and preventative services that are on offer for prospective employees. So, interestingly, before the pandemic, we did a few webinars, and I've done a lot of client meetings where, mental health was a real important consideration. And we certainly feel we were leading the way in that pre-pandemic. But I think it's really clear now from the data and that this needs to be a #1 priority for businesses. Perhaps even more so as we transition into hybrid working. I think it's really highlighted the fact that that mental health and resilience are so important, and businesses have a role to play in that. And I think, finally on this section, I suppose just really making the point as well that mental health and physical health are not mutually exclusive. So we need to be really clear here that all of that impact I talked about earlier around long COVID and physical as well. So really, really important that we're aware of that, and especially with that figure of, I think 61% there of employees felt the pandemic had a negative impact on their well-being. Quick mention of hybrid working as well. I think certainly for me and for many of my team and people I speak to, this is a good development. People are looking forward to getting back into the office, but don't want to get back to kind of 5 days a week of commuting and the impact of that. But I think there's potential here for it bringing a new set of risks that we'll talk about a bit later on. People are working harder, potentially in longer hours at home. So is that likely to have increased burnout? We've got this blurred boundaries, which I've probably talked about on every call and webinar I've been on, where we've got these, three personas: our home persona, our work persona, and our internal persona. And really, the COVID pandemic has completely blurred those boundaries between work, home, and our individual kind of internal life. So, and that's a real impact on mental health. So how we can support employees to reintroduce some of those boundaries is really important. So final couple of points on this. We know that awareness and access to support is vital, and we've been developing our services. We have online cognitive behavioural therapy, direct access, as I mentioned earlier, and 24/7 family mental health line support. But I'll just finish on this point that it doesn't matter how many of these services and benefits that you have, they're only impactful if people know about them. So really encouraging businesses, as people start heading back into the office, to review their communication strategies and ensure they're promoting these benefits to their employees. So finally, I'm just going to briefly touch on MSK, and this is the topic for our panel discussion. So just very briefly to set the scene. So before COVID-19, about 5% of the workforce was based at home. And I think within weeks of the lockdown, that increased by an additional 44%. And there's a UK-based study, which is very interesting. It shows that 52% of people with existing rheumatic and MSK diseases, so arthritis, rheumatoid arthritis, osteoarthritis, have had worsening symptoms during the pandemic. And that was worse for working age people. And I think we should all take note of that, because those same people are then going to be coming back into the office environment part-time as well. And that research that we carried out in 2020 showed that nearly 2/3, which, if you extrapolate up, is about 11 million Brits have injured their back, neck, hips, knees, and wrists as a result of their home working environment. Again, which is a significant risk. Some interesting data from our Bupa physio line. Lowest ever number of calls during the first lockdown, and perhaps that was due to people putting off getting help, not wanting to enter a healthcare setting if they were referred. But in Q1, self-management treatment in this year and supporting customers virtually was running 8% higher than the previous year. And in April, we've had our busiest week ever with over 1,000 calls. So that surge in customers now coming back confident to attend appointments after waiting so long, and clearly wanting to get problems sorted. We're seeing that coming back. So I think the move to hybrid working is going to bring a lot of further challenges. So we expect a significant number of employees will return to the workplace with those musculoskeletal issues. So it's vital that, again, we encourage people to get their symptoms checked out and not delay, accessing care. I'm looking forward to hearing more from the panel on what risks and measures we all need to consider as responsible businesses. And so I'll finish there and I'll hand back to Mark. I'll hang around for questions later on. Thanks, Mark.
Thank you, Luke. Great session as ever. We probably put you through your paces today. I think that's a marathon session for you. Normally we ask you to do 10 minutes. I think you've done about 15 there, but as ever, a really, really thorough analysis really of what we're seeing going on at the moment, and nicely teeing up our panel discussion. So let's move on to our panel discussion. Without further ado, let's welcome our panel onto the screen. Good morning, everyone. Thank you so much for joining us and taking the time to share your views with our audience today. As I said earlier, we've got a great lineup of expertise today. Emily, you're going to share insights from the clinical frontline at Bupa. Cherry, you bring knowledge and research from across the MSK charity sector. And Breege and Mary, we're hoping you're here to share what risks you see employers facing around occupational health. So loads and loads to get through. Lots of questions we've got planned, and lots of questions already actually coming through on the chat. So let's get cracking. And I'm going to start with you, Cherry, if that's okay. So from what you see from your experience and what you're observing, how prevalent do you see these MSK issues within the workplace?
Thanks, Mark. And I think that's a really important question, because I think often people don't realise how prevalent MSK conditions such as arthritis are. especially within the working population and the impact it can have. I think people tend to think it's something you get when you're older. So whilst prevalence does increase with age, MSK conditions can occur at any age. I think that's important for us as employers to realise. That includes children, but also young people. They may be people who are just starting out and thinking about their careers and going into the workplace, and also people of existing working age. So some of the work we did before lockdown showed that well over 18 million, so that's 18.8 million in the UK, are already living with an MSK condition such as arthritis. And of the working age population, the working population, that amounts to 1 in 10 employees who are reporting having an MSK problem. So, and those are the ones that are reporting it. So as we've heard actually from earlier, there's been an increase in issues, and that matches with the research we've done, that there's been an increase in issues reported as a result of COVID, and people who wouldn't normally be working from home, who might be normally based in an office, now increasingly working from home, so that in that first stage, 4 in 5 people after lockdown who would not have worked from home previously were reporting increased in back, neck and shoulder pain, where they were now suddenly working from home and maybe didn't have the appropriate support. So it's really important to think about what support can we provide for people to both prevent and for those who have existing MSK conditions.
Thank you, Cherry. Really interested to see that you're seeing very consistent things to those that Luke has called out. So I'm going to come to you now, Emily, if that's okay. So from a clinical point of view, talking about our own experience here at Bupa, what trends are we seeing if we get under the skin of this a little bit more?
Thanks, Mark. Yeah, really interesting. There were definitely 2 distinct groups that sort of came to the forefront. So there were those people who were at home with suddenly more time on their hands and suddenly had time to exercise, and were full of good intentions, but potentially exercised too much too soon. So therefore ended up with quite a lot of, we saw quite a lot of people with overuse injuries. So Achilles problems, knee pain, those sorts of things, particularly runners, I would say. Classes were shut, gyms were shut, pools were shut. So running became the thing, as well as HIIT classes and things on social media and YouTube and places that you could sign up to. So there was a group that went a little bit crazy at first. I think also there was that temptation to go out and exercise, because there was one point where it was probably the only reason we could go out of the house apart from going to our food shop. So suddenly the actual thought of going out for a run was something to do. It was variety. So there were definitely those overuse people. And then the other group was at the other end of the spectrum, where people were exercising far less. Those who were working from home, no longer are they stopping off at the gym on the way home. They're not moving around half as much as they would. So they haven't got a formal lunch break. They're not standing up to go over and speak to a colleague. They've not got their commute anymore. They were often set up at home, probably not great as well. People were using laptops, often on the kitchen table. Your kitchen table tends to be quite high. So we were seeing quite a lot of people who were sort of scrunching up and getting lots of shoulder and neck issues. Or people were sat on the sofa with their laptop on their lap, or even in bed. For people who were sort of in, small studios, bed sits, as Luke suggested, suddenly your work and your home, those boundaries are really blurred. So as a result of that, there are lots of people who had neck and back issues. We also saw a lot of general deconditioning of that group as well. So they were just more prone to injuries from just simple activities because their bodies weren't conditioned as they used to be. Also, as both you and Mark and Luke have both said, there was definitely a decrease in people accessing healthcare. So when we started to open our centres up more and more, they were open all the way through lockdown, but people weren't keen to come, and I understand why. From April, our volumes went through the roof, both on physio lines, so our direct access on the phone, but also in our centres. And we saw a lot of people who had quite complex health needs. I would say they'd stored up their problems for quite some time. And added to that, like Luke suggested about that link with mental health and MSK, they were worried about their symptoms, they hadn't got better. So when you start to factor in stress as well, then it's harder to get better quicker. So they were the main things that we saw.
Brilliant, thank you. I was kind of laughing to myself there, as I'm sure a lot of the audience were, maybe, about recognising ourselves in any of those conditions. My family have certainly got me walking around with an ice pack around my ankle from thinking I can run faster than I actually can, and I know about the back pain from being hunched over the dining room table when you think it's okay, and when you're doing that day in, day out, clearly it starts to take its toll compared to just doing it every now and again. So really great update there. I think we're going to set a poll live now. So this is around whether you believe your business has supported people with their MSK health during the pandemic. So we'll let that take care of itself whilst we ask another question. So I'm going to come to you this time, Mary, if that's okay. So can you give us your perspective on the legal duty of care that employers have in relation to employees' health, safety and welfare, and the impact of this move to this new hybrid working environment?
Yes, absolutely. Thanks. I mean, in terms of legal duties for health and safety in this hybrid environment, the starting point is always going to be your duty under the Health and Safety at Work Act as an employer to ensure, so far as reasonably practicable, the health and safety of both your employees and also others that your business activities might impact. So that includes considerations for contractors or fixed-term workers, etc. But having set that overarching duty, the question is, of course, well, what does reasonably practicable mean? What can you do to ensure worker safety or well-being and health in this hybrid environment? The law does help you. It gives a few more specifics on the expectations in that space. So firstly, you need to be identifying relevant health and safety risks in that hybrid environment and carry out what's deemed to be a suitable and sufficient risk assessment. And the management regulations tell you to do that. Secondly, in terms of workstations of your workers, so desks, computers, chairs, etc., the display screen equipment regulations provide you quite detailed information about what legally you have to do around assessment, but also there's a schedule which sets out what kind of equipment that you should be providing and the requirements around making sure that equipment's properly set up and that people know how to use it. All of that law applies in both the traditional and the hybrid working environment. But what the move to hybrid working's really flagged up for us is that just so many businesses have been approaching, rightly or wrongly, these issues in the same way for years. So if you think about it, for many of us, our businesses may have had people in fixed desks that have been set up for them maybe like day one of starting work in the office by somebody in facilities, and they've remained like that ever since. Clearly, that type of arrangement for making sure it's set up correctly doesn't work if people are hot desking or working at home or maybe in lots of different places and traveling around, etc. So the big change that we're seeing is that businesses are really having to go back to not only all the principles that you've just heard spoken about, but also to these legal duties and seriously think about how do you make all of that work in this new environment that we're in. So I think the biggest change, which to be honest, I think is probably well overdue, is that there's a real need to educate individual workers on how to know themselves, how to sit comfortably, how to work comfortably, how to set up their workstations and about important things like breaks. As an employee, you just can't do that for somebody if they're, for instance, working at home. But other big issues we've also seen have been around equipment provision by employers to make sure all those legal duties are actually being met.
Great, thank you. It certainly adds a whole another layer of complexity, I think, on something that was already quite challenging for employers. I've got the poll results in. I'm really pleased with this, actually. I didn't know what to expect, but the good news is that 78% of people answered yes to the poll, that their employers, their businesses have supported people well with their MSK health during the pandemic. So if that's replicated across the UK economy, then hopefully that's good news. I guess it still begs the question that one in four businesses haven't. So maybe there's more trouble ahead from that perspective, but we'll see, I guess. Cherry, I'd like to come back to you if that's okay. So we've talked about the physical injury, if you like, and some of the employer's responsibility. But when we think about these MSK issues, what effects do you think they actually have on an employee's well-being and quality of life?
Thanks, Mark. And like you say, we've heard some of them just now in terms of the impact of injury and in terms of pain and in terms of MSK issues. Then we know that 78% of people with an MSK condition say they experience pain, and they experience pain most days. So if you think about that in terms of the impact that then has on somebody's well-being and quality of life. And it can make some daily tasks more challenging. So things that we might not think about day to day can be more challenging, and that might be in the workplace, but also not forgetting the daily commute as well. And MSK conditions can sometimes be invisible conditions, and people might not always recognize that somebody might need a seat, and it might be difficult to stand on the daily commute or things like that. So it's quite often those daily tasks can become more challenging. And MSK conditions, along with mental health issues, and I know they were referenced earlier, actually then become the top 2 reasons for sickness absence from work, and there is a proven link between the two. So MSK conditions and mental health really having that impact in terms of sickness absence for people, and we know that results in over 28 million working days lost due to MSK conditions throughout a year. It also means that as a result of that, there is a reduced number of people with MSK conditions that are actually remaining in work. So there is a reduced number. So 63% of working age adults with an MSK condition compared to 82% of people that don't have a health condition in terms of remaining in work. And you're therefore more likely to retire early. So there's lots of quite significant impacts that it can have in terms of quality of life and well-being. Yet we also know that often, sometimes small changes can make a huge difference to help people stay in, but also to really thrive in the workplace.
Great, thank you. So Emily, I'm going to come back to you. Obviously, any of us who've worked in offices right now are having this hybrid conversation, and we're all starting to think about going back in or even making those first steps back into the office. What do you think organisations need to do to practically consider how to support people specifically with this MSK issue, and any thoughts about how Bupa might be able to help there?
Yeah, absolutely. So I think if it's planned well, I think hybrid working could actually be really beneficial from an MSK perspective, because you could almost get the best of both worlds. You could get the working from home where potentially you've got more time to exercise, that work-life balance is possibly more there. And then if you're in the office, then you've got more the commute, it makes you move, you're going to see people, you're hopefully having those getting up, standing up, going over to speak to a colleague. So our bodies, we like movement and we like variety. That's how our bodies and our muscles and our joints all thrive. We don't like keeping still for long periods of time. So what I would say from a business perspective is I think there may well be a temptation that people, if they do have that hybrid working from home and in the office, they may want to go for a Monday and a Friday at home and then Tuesday, Wednesday, Thursday in the office. And I can see why, but actually from a MSK perspective, people are actually better probably alternating and spreading that out equally during the week, because otherwise you're going to have 3 days where you've got that sort of high stress commute environment, and then it's almost like, again, it's those two spectrums, those two ends of the spectrum again, that boom or bust, while you're better off spreading things out equally. So I'd encourage that. I think when you're in the office, there may be the temptation to try and cram as many meetings as possible in those days, because suddenly you've got people around you. Again, I try to just make sure that there's time in people's diaries, that they're not in meetings, because again, otherwise you're just sat all day again, but just in a different place. I think I certainly have, I've missed those spontaneous conversations with people and the ideas that come from that, rather than everything being planned within an inch of its life on Teams or similar. So I definitely have time in the diary just to have those water cooler moments, as someone called it the other day, to get up and meet people again, because again, mental health and MSK both would benefit from this. I think, as Mary sort of outlined, earlier, that desk setup is really important. There will be hot desking for sure, so it's educating people that about how to set up their desks. It doesn't take long. Once you know what to do, it's literally a quick 5 minutes in the morning just to check everything's level, that your eyes are at the top of the screen, that your chair's set up correctly. And the same at home, and making sure people have got the right equipment at home to support them with that setup. And then lastly, I would say business is encouraging people to access healthcare early if they've got MSK conditions. So I know as a physio, if someone comes in to see me and they've got a niggle or an ache, we can nip it in the bud quickly, because it hasn't got to a stage where actually it potentially needs more assessment, more treatment. The mental health side of things has started to kick in. So you're better off seeing someone early on, where often self-management strategies, whether it's postural advice, whether it's some simple exercise to do, will sort it out. So I think if management and leaders are encouraging people to do that and setting that example themselves, Bupa's great. It's got its direct access. You can most people can speak to a physio on the phone or video call within 24 hours. So I'd absolutely be encouraging people to do that. It's really important.
Great, thank you. I'm going to come to you now, please. Okay. So when we as employers are thinking about introducing these hybrid workplaces, what do you think are the main kind of business risks that they ought to be really focusing on?
Oh, thanks, Mark. Well, really, from a legal perspective, the way in which the courts are interpreting the duty of care is already changing to reflect the realities of hybrid working. So, for example, in relation to MSK injuries, the risk assessment must reflect the employee's work environment, be that in the office or at home or a mixture of the two. So risk assessments really must be dynamic, and the challenge is to enable workers to conduct those risk assessments. And likewise, what we're seeing with mental health and well-being, the courts used to find that employers, for example, who provided a confidential counselling service to their employees had discharged their duty of care. But in recent cases, what I'm saying are judges that are referring to comprehensive guidance that's available on the issue and commenting that risk assessments must be more proactive at identifying mental health risks and putting in place measures to eliminate or reduce those risks.
Great, thank you. Cherry, I'm going to come to you now, if that's okay. So we've talked about the very obvious reasons why an employer might need to support someone with an MSK condition, i.e. just stop them going off with absence. But do you think there are wider benefits that employers can benefit from providing support with MSK conditions?
Thanks, Mark, and absolutely, and like you say, the sickness absence statistics, I think, speak for themselves in terms of the cost that therefore has. But actually, there are all those benefits in terms of diversity of the workforce and being able to retain experienced, quality employees, and actually have people working to maximum benefit and productivity and working at their best. So if you are well, if you can be well, you can work well. So I think it's really important to think from an employee perspective that it is actually a win-win, and it's not about just benefiting employees, but it's actually about benefiting to the business as well. So all the things that we can do then to support somebody to be and work well and do their best is going to be beneficial for actually the delivery of the work in your business.
Great, I completely agree. I mean, it's the same, I think, with any health condition. When you start to think about the broader benefits, whether it's mental health, early encouragement of employers to encourage people to seek help for a potential cancer condition or MSK, the same is true. I think the business always wins by providing that extra level of support. Emily, crystal ball time then. So what's your prediction for MSK conditions and specifically what sort of trends we might see emerge as we go to the next phase of this interesting period?
Yeah, I think interesting is the word, isn't it? I think there'll be a real mixture. I think those who have discovered exercise, hopefully they calm down from their initial over-enthusiasm and settle down into a nice sort of safe level of exercise. Hopefully have found those benefits and will continue to do that. as long as they don't get sucked back into potentially bad habits beforehand. But I think there's a lot of people who have sort of, this experience has made them really stop and reevaluate what their priorities are and what's important to them in life. So I think health has obviously been a key focus of conversations over the past year. And I would think that more people now will potentially listen to those niggles and aches and not ignore them, because they now put health more as a priority. So I think more people will potentially start to access healthcare with these problems that they potentially ignored in the past. I think we've all seen on the news and the media things about the NHS and backlogs and waiting lists and things. So I think if people have got private healthcare, they may use that in the first instance, while historically they may have seen their GP first. So I think in the private healthcare world, we could potentially see more people coming through. I think those who have been deconditioned, they'll either stay deconditioned or, I'm hoping, they will start to get back to their exercise. It may be that they've not exercised because they are really keen on swimming, so the pool's been shut. Now they're open again. So I'm hoping that people will start to go back to their classes, to their gyms, to their pools. They can now exercise with friends, whilst I say at one point it was really quite limited what people could do. I think people are more open to virtual healthcare as well, which has been really interesting to see. So when we started doing sort of video calls, at first people were, how do you do physio over video? But actually it's worked very, very well. A lot of people, I as a physio can see the way someone's moving in front of me, their joints, their muscles. I can give someone exercises, I can demonstrate it to them. Absolutely still with the caveat, if people need to come in face to face, they can do so. But I think people are more open to that now. And that's got huge benefits, because people can access healthcare from the comfort of their own home, or even the comfort of their own workplace if they've got a private room that they can go into. So a real mixture, I think.
Great. Well, we'll need to get you back on, I think, again in about 12 months' time, I think, to see what we're seeing and whether you were right. And we're going to set another poll live now. So I think this one is really coming at the point that I know, as from my own perspective, moving to hybrid working requires you to think about an enormous amount of things and a lot of very practical logistical things. But the question we'd like you to answer in the poll is your business preparing to support employees with their health and well-being in a hybrid working model? Some of these these sentences become mouthfuls when you start talking about hybrid working models and health and well-being. I'm struggling to say it all in a slick fashion in a sentence. So we'll set that poll live, and then I've just got a couple more kind of legally based questions coming to you, Mary and Breege, before we go to the questions that have been coming through. So Mary, who owns the employment health and well-being risk agenda in an organisation?
Yeah, that's a really interesting question, actually, when you look at health and well-being and you think about all the types of risk issues that we've been discussing. So I suspect that we've probably got quite a lot of HR managers, professionals on this session who might say, well, a lot of this, I think, sits with me. It's pretty commonplace, but there will also be sort of property or facilities professionals. And then there's going to be those who are looking at things like writing policies or risk assessments, and maybe that's with a health and safety team. So that's obviously three potentially different teams who are overlapping on the issues that we're talking about. So I think one of the big questions is, well, how do you make that all work? We've been doing quite a lot of work in this space over the last couple of years, and our approach when asked is to look at health and well-being in a risk context in the same way that we often look at health and safety issues. The law, the Health and Safety at Work Act, and a lot of the supporting regulations covers both, and the duties are therefore the same. The HSE and the Institute of Directors have got some really useful guidance to help businesses set up their framework approach, which ensures that risk is being managed appropriately. So at the broadest level, that will look at things like who's got ownership and accountability, who are the technical specialists, and how does all of that fit together. And likewise, many of you may have looked or be really familiar with the ISO accreditations, including ISO 45001, which looks at these framework issues in this space, and also the new ISO 45003, linking and focusing on that well-being piece. what I've found is really important to looking at when you're looking about this at first is to really understand, firstly, in your business, what are these health and well-being risks in a hybrid environment? What do they look like? And then also, what skills and experience do you already have in your business of people who could support? Because it's not a one-size-fits-all approach in my experience, and health and safety teams or other risk teams are going to be really skilled, as I say, in looking at this as a risk issue. They know how to follow the HSE's guidance, etc. But then we do have property facilities teams who are really good on maybe understanding practical constraints about things like equipment. And of course, HR teams really understanding about the impact on people and maybe being the direct link into OC Health and for instance, Bupa services, etc. So you might want to have all of those people feeding in, but have a single point of ownership. I just think on this question, it might be worth leaving you with the piece that we're starting to see a real trend in businesses looking for combining so that they have a health, safety and wellbeing manager, which I think is a fantastic idea and something to look at. But there are, I think, some real skill set gaps in professionals when you try and put that into a single role. What I think is important is whether you're talking about MSK or lone working, mental health issues around hybrid working, is that you do think about this as a risk piece and how you're going to mitigate that risk and reduce it down, as well as all the separate great work that you might be doing about broader wellbeing programs. Because otherwise what you might be doing is investing a lot of money in fantastic programs, but they may not immediately address the risk exposure that you've got.
Great, thank you. And I'm just going to ask one final question before we go to some of the questions that have been coming in. And also, by the way, I've got the poll results in. I've just been reminded. So great news, actually, 93% of you said yes, your organisation is thinking about health and wellbeing as we move to a hybrid model. So I think maybe one of the things that's coming out of the whole experience is organisations just taking their responsibilities maybe more seriously than perhaps we all did beforehand. So really, really encouraging results from the polls. Just to you, Breeze, just quickly, and I'm just going to ask you to focus on sort of the bad lessons that we've seen. Can you pull out any lessons or examples of real poor practice that you've seen during the pandemic, that really are the sorts of things that people really need to avoid into the future?
Sure, Mark. Well, I think at the start of the first lockdown, the HSE actually amended its home workers page to say that there was no increased risk for DSE work for those working at home temporarily. So I think a lot of employers relied on that temporary exemption, and employees were working off laptops without separate keyboards or a mouse at the kitchen table, on the kitchen chair, or the 2020 version of the standing desk, as we know it as the ironing board. But really, things have moved on now, and we've been advising our clients since last summer that the DSE regulations apply to employees working from home on a long-term or hybrid basis, and therefore risk assessments must be completed and equipment provided where necessary. And so again, linked to that is home working can cause that work-related stress, and as work-home boundaries become blurred, there may be a lack of contact or supervision. So for me, and my two takeaways from today would be to recognise the change in emphasis of the risk assessment process and the move to online assessment and recording, and training of employees how to carry out those risk assessments is going to be key. And secondly, the duty of care and respect of employees' mental health and well-being is proactive rather than reactive. And there's lots of helpful guidance out there, and I would recommend two in particular. So ISO 45003 that Mary's already referenced, that was published last week, and that provides practical advice on preventing mental ill health and promoting well-being at work. And secondly, the HSE guidance booklet on tackling work-related stress, which includes a step-by-step workbook. So to finish with, I would just say if you address those two issues in a proactive way, employers can reduce the risk of personal injury claims and create a better managed, supportive and productive work environment.
Great, thank you. We have got quite a lot of questions in, but I'm just going to be pretty ruthless with the time, given we've only got about 5 minutes left on the session. So I've got a question here for you, Cherry, which I think is a really interesting one. So someone has written in saying, we often talk about breaking down the stigma of mental health in the workplace. Do you think there's a similar stigma around MSK leading to people just battling on and hiding the condition?
Yeah, I think that's a really good question, because I think absolutely sometimes that can be the case. And like I said earlier, sometimes it can be an invisible condition as well. And so there can be a real issue around that. And so I think it's really important that actually, just like mental health for MSK Health, as employers, we are really supportive and really vocal about the fact that we do support people and their well-being and their MSK Health. We've got a real opportunity now with the hybrid working and the back to the office to have those conversations with people, to do those risk assessments, as people were saying, and really have the conversation to see what does working well look like for people, and what support can be provided. Have they got an MSK condition? What support can be provided if they need that support? As employers, we should be making reasonable adjustments. What might they look like? And also promoting access to work, which is a government scheme that can actually provide additional support where it goes beyond a reasonable adjustment. And lots of people don't know that that's available, and that can provide really positive additional support for people. So I think all of those things can be really positive to overcome that stigma, and actually focusing on something that Emily was saying earlier as well, critically promoting movement, being really showing that you promote movement, physical activity, taking breaks, keeping moving, and actually role modeling it as leaders as well, so that you're showing you actually mean it, actually things like that. So it's a real visible support and you're living it within your culture and ways of working. I think really important to start breaking down some of those barriers.
Brilliant, thank you. And I'm just going to have one final question, which is going to drag us, I'm afraid, back to the topic of COVID specifically. So maybe moving slightly away from MSK, because someone's asked a question here, and I love the way they've addressed it to Dr. Luke. I always like it when that happens, whereas we just know him as Luke. But Dr. Luke, if I'm vaccinated, am I less likely to pass COVID to someone else because I'm less symptomatic or have no symptoms at all as a result?
So I think, as we've always said on these questions, there's loads of research going on about this. It's looking as if that if you've been vaccinated, you are obviously less likely to contract COVID, but you still can get COVID and you still can pass it on. But you are less likely to be hospitalised and less likely to get severe disease. And therefore, we think that the research will then show you are less likely to be passing it on and transmitting it. So I think it's all good news around the vaccinations from that point of view.
Brilliant. Thank you, Luke. So I think we're going to have to draw a line under it. We had many more questions coming through there, and lots of quite specific questions. So as ever, we will make sure we try and get answers back to the people that have asked those questions after the event. I think what's true today is maybe something that looked like quite a dry topic coming in is actually a very rich topic. Some of the answers there had loads in them, and we've come at that topic from all sorts of different angles. One of my takeaways, just listening to the discussion there, is there is no doubt as employers we must take really good care of this move back to hybrid working from an MSK perspective, but also, as well as just doing your duty to what you must do from a health and safety perspective, I think there's also a massive opportunity about what you choose to do. And we heard, I think Cherry talked about some of those wider benefits about looking after your people, and creating that cultural of warm support. So I think that's really important. I think it was really interesting for MSK to get talked about today. Maybe one of my observations of my time at Bupa is we talk a lot about mental health, we talk a lot about cancer, but maybe MSK doesn't get discussed. And I think all the issues, they're different, but there are many, many issues underneath the surface here that we need to really take good care of. And I think if there's one theme for me that is emerging across every single discussion that we've had, whether it be cancer, mental health, today, MSK, it's that we all as employers need to do everything we can to keep encouraging employees to walk towards seeking treatment, seeking that consultation to find out if there's anything wrong, so that we can get help for people early on, and everyone benefits from doing that. So thank you so much for joining us today. Thank you to all our panelists, fantastic authoritative answers. And we look forward to seeing you again at the next Health Insights Live in a few weeks' time. Thanks for joining.